Hello everyone, my name is Dr. Amanla and welcome to my YouTube channel. Today we shall discuss genetic disease, Down syndrome. So Down syndrome is a genetic disease. It occurs because of trisomy. So Down syndrome is a genetic disease, occurs trisomy on 21st chromosome number, and it is most common autosomal disease. Most common autosomal disease which occurs in patients is known as Down syndrome. It is chromosomal abnormality, occurs on chromosomal number 21. Irregularity approximately 1 out of 700 live births. Down syndrome occurs. It increases with maternal age, and most individuals with Down syndrome have full trisomy on 21st chromosome due to meiotic non-disjunction. So, in patients, 1 out of 700 patients uh, become affected from this genetic disease, Down syndrome. So pathogenesis and meiotic non-disjunction in Down syndrome occurs. There are facial and cranial features. Faciocranial dysmorphogenesis in the patient of the Down syndrome, like patient will have flat faces and abnormal facial appearance, and periorbital uh, epicanthal folds will be there in the patients of Down syndrome, and other features like bradycephaly will be there, hypoplastic nasal bones and broad flat nasal bridges will be there in the patient, and ear anomalies in there, low set ears, adherent ear lobes, short neck, excessive skin at nape and nape of neck, and is seen in perinatal ultrasound. So these are features of patients of Down syndrome. Skeletal features like patient will have atlantoaxial instability, short stature, reduced growth with shortening of long bone. Average adult will have a height of 4 feet 11 inch. So patient will have relative low IQ and short stature because of skeletal deformities, and reduced growth of the patient with shortening of long bone that will eventually result in short stature of the patient, and they will have low IQ because of course development of the brain. They will have low IQ and they will exhibit low school activities and poor performance in school activities. So that is a clinical finding of the patients, and they will have a small oral cavity together with a large furrowed tongue, which results in appearance of a protruded tongue, high arched and narrow palate with teeth have late development and small in size, and short roots of the teeth, large gaps between teeth occurs in the patient of the Down syndrome. So how one can diagnose the patient of Down syndrome? For diagnosis, clinical examination like prenatal examination can performed for diagnosis of the Down syndrome. It depends upon the week of gestation, and in which a week of gestation is mother there. So the what is the treatment for the patient of the Down syndrome? The treatment is evaluation of the parents of the patient, and doctor must inform the parents of the patient that their child is suffering from Down syndrome. He has low IQ, and because of low IQ there will be poor performance in the school activities, and there may be cardiac malformation in the patients of Down syndrome, and early targeted intervention should be there. Educational support should be given to the patient, and they should be admitted in special schools for the patients of genetic disorders, and physiotherapy can be there. Behavioral therapy should be done, speech therapy and occupational therapy should be done in the patients of Down syndrome. So Down syndrome is a genetic disorder, occurs on trisomy 21 and 21st chromosome, non-disjunction disorder, in which patient present with features, four special features, and epicanthal folds will be there. Short stature, low IQ, and poor school performance of the patients will be there, and it can be diagnosed perinatally and in during gestational weeks, and patient should be given counseling according to the need, like basic physiotherapy and educational therapy should be given to the patient. So in this way we can treat the patient of the Down syndrome. If you like my video, please subscribe to my channel and keep stay connected with me in order to gain further information regarding medicine and different subjects of medical school. So thank you.